Hey everyone, welcome back to Wait It Gets Better. This is episode 57, and today we're talking about ADD. Now, I have spoken about being originally diagnosed in the past with ADD rather than my actual bipolar diagnosis, and on this episode, I will clarify why the two are commonly confused. And I'm going to do this episode like I did the last one and read facts and do story time as I go. I didn't have anything written out specifically. So let's dive in. So I asked the research, what is ADD? ADD, known as attention deficit disorder, is an outdated, largely unused term for a subtype of ADHD, characterized by chronic severe inattention, distractibility, and poor organizational skills. I don't see the thing is a lot with this research. I don't like how I don't like how it's very stigmatizing a lot of the things that it says. So just because you have ADD doesn't mean you have poor organizational skills. So, like I said, I read as I go, and then as I read things, and I'm like, okay, let me clarify. That is probably not true. It is just very stigmatizing. Anyway, let's get back on track. So it's ADHD without the hyperactivity. So it's a subtype of ADHD, officially renamed as the inattentive type of ADHD in 1987. It involves difficulty focusing, following instructions, and finishing tasks, often causing significant issues in school, work, or daily life. Like I said, a lot of this is very stigmatizing, but I'm just reading as I go. So, key characteristics and symptoms: inattention, frequent careless mistakes, trouble sustaining attention, and not listening and losing items. Disorganization, difficulty managing tasks, time, or deadlines, cognitive issues, easily distracted, forgetful with daily activities, and mental exhaustion. The lack of hyperactivity, unlike typical ADHD, individuals with this profile are not usually physically restless, acting more like they are daydreaming or in a fog. The diagnosis, now classified as ADHD inattentive type, it is diagnosed based on long-term 6+ months behaviors. Treatment often managed with stimulant medication that enhances brain focus, along with therapy to improve organization and behavioral coping strategies. While the term ADD is technically obsolete in clinical, is still frequently used in common language to describe the specific non-hyperactive inattentive profile. Now, I asked how bipolar and ADHD and ADD are confused, and this is what it says. So, this is what the research says. Because remember, I said I was originally diagnosed ADD when the whole time I had bipolar. And I'll also talk about how it can be detrimental when you're not being treated for the proper mental illness and what being treated for ADD with ADD medication can do for with your bipolar disorder. So let's talk about it. We're gonna cover all bases today. Bipolar disorder and ADHD are frequently confused due to significant overlap in symptoms, particularly impulsivity, hyperactivity, inattention, and emotional dysregulation. Manic episodes can mirror hyperactivity, while depressive episodes may mimic inattention and lack of motivation. Furthermore, these conditions can co occur, complicating diagnoses. The shared symptoms are both conditions involve high energy, distractibility, fast paced talking, and irritability. The impulsivity, while both display impulsivity, ADHD impulsive behaviors are typically chronic, whereas bipolar related impulsivity is often episodic, emerging during mood shifts. So we have nature of mood shifts. Bipolar disorder is defined by extreme lasting shifts in mood, mania, and depression. In contrast to ADHD, related emotional dysregulation is usually shorter lived and often tied to frustration or sensory overload. Sleep differences: those with bipolar may experience a diminished need for sleep during mania, whereas individuals with ADHD may struggle with insomnia or sleepiness due to racing thoughts. The comorbidity: in 10 to 20% of cases, individuals may have both conditions, making it difficult to tease which part. Excuse me. Let me. Making it difficult to tease apart which symptoms belong to which disorder. And the key differences for differentiation: consistency. ADHD is generally chronic, constant, while bipolar is episodic, occurs in waves. Onset ADHD usually presents in childhood, while bipolar typically appears in late adolescence or early adulthood. And some triggers are bipolar symptoms are less dependent on environment, while ADHD symptoms may improve in stimulating situations. Now, I have spoken about being treated for ADD when I had bipolar and how that was detrimental to my developing brain at 18. I wanted to do research and to give more explanation as to why it was so detrimental. So let's talk about it. Treating attention deficit disorder while having bipolar disorder and a developing brain is complex because stimulants commonly used for ADD excuse me, can trigger mania, psychosis, and irritability in a bipolar disorder affected brain. However, if a mood stabilizer is used concurrently, it reduces the risk, and long term medication may actually support healthier, more typical brain development. Key points regarding the impact on a growing brain usually include risk of mania. Stimulant medication for ADHD can increase the risk of inducing manic or hypomanic episodes approximately sevenfold, according to some studies, when used without proper mood stabilization. Targeted treatment guidelines suggest a hierarchical approach, stabilizing the mood disorder bipolar first, then addressing the ADHD, typically using a combination of medications to avoid negative behavioral or structural effects. Now, neuroprotection versus risk. While there are risks of causing mania, some evidence suggests that consistent long term treatment of ADHD, especially when monitored, may lead to neuroprotection, potentially helping to normalize the brain structures in children and adolescents. Excuse me, guys. White matter development. Research indicates that methylphenidate, a stimulant, may affect the development of white matter in the brains of children, which is crucial for learning and cognitive function, though these changes are not observed in adults. Effective treatment of concurrent ADHD and bipolar disorder requires careful, often staged management to balance the needs for focus, which the stabilization of mood, ultimately aiming to support rather than hinder brain development. Now that's interesting. See, excuse me. I was cleaning, excuse me. The reason why I'm so like stuffy and my throat is a little dry, I I was deep cleaning my room today and it was so dusty that it's causing me to like have all these allergic reactions to like my nose is stuffy, my throat is like dry, so bear with me. I should have gotten myself some water before I did this. But anyway, so like I said, I was being treated for ADD. And I mean, I got like a little description as to why that was detrimental from my psychiatrist, but I wanted to do more in depth. Like as an adult, I want to understand more of why my like me being treated and going to all these therapists wasn't like helping. I truly needed the right medication and I wanted to do more research on it. So I'm glad I kind of educated myself on that a little bit more. Um so now here are the symptoms of ADD. ADD, now formally diagnosed as the inattentive presentation of ADHD, involves chronic persistent patterns of inattention, distractibility, disorganization, forgetfulness that impair daily functioning. Common symptoms include difficulty sustaining focus, losing items, poor time management, procrastination, and daydreaming. Is distinguished from typical behavior by being severe and long lasting. Now, I'm just saying, just because you have ADD or ADHD doesn't mean a lot of these symptoms, are going to cause you to be held back in life. And like I said, I'm going to talk about in the end, like I always do, I'm going to talk about the people who have become successful living with ADD or ADHD. So that's why I do that part because like I said, a lot of this research, like I like to clarify if I think if it's very stigmatizing, a lot of the things that it says, but a lot of this is very like, oh, like the things it says is very like stigmatizing. So, difficulty staying focused, easily distracted by unrelated thoughts or stimuli, trouble paying attention to details, and making careless mistakes, disorganization, struggles with time management, prioritizing tasks, meeting deadlines, and keeping belongings in order, forgetfulness, frequently loses items, keys, wallet, phone, forgets appointments, and forgets daily chores, poor task completion, difficulty finishing tasks, often skipping from one unfinished project to another, daydreaming, not listening, appears to not listen when spoken to, tunes out frequently, avoidance. Dislikes or avoid tasks requiring sustained mental effort, such as paperwork or reading. Additional symptoms in adults: chronic boredom or procrastination, restlessness or anxiety, relationship problems often due to forgetfulness or not listening. I mean, I'm sure that's definitely not true. Like, I'm sure, like, that's not the catalyst in a lot of people breaking up. But this a lot of this research is ridiculous. But I read it anyway, and then I like to clarify. Like I said, mood swings or low self-esteem, employment issues due to poor. That once again, that is ridiculous. A lot of these like things are very, very dramatic. Like employment issues due to poor. That's not true. That is not true. Oh my god. Anyways, key differences from ADHD. Unlike ADHD with hyperactivity and impulsivity, individuals with pure ADD often do not show significant physical restlessness or impulse control issues. Symptoms must be present before age 12 to be diagnosed. Now, I was diagnosed originally at I think I was age 12. So it was right after my grandmother passed away. It was that summer my mom took me to a neurologist. And I was like I said, originally diagnosed with ADD. So yeah, I was like 12 years old. So that does make sense what that's saying. Now here is how you can be I cannot talk today. Oh my god. So here's how you can treat ADD. Treatment for ADD, ADHD generally involves a combination of behavioral therapy, medication, and lifestyle adjustments tailored to the individual, often combining approaches for the best outcomes. First-line treatments typically include stimulant medications to manage symptoms, along with cognitive behavioral therapy, CBT, to improve organization and focus. Behavioral therapy helps individuals manage symptoms, improve organizational skills, and reduce impulsivity. For children under 6, parent training in behavior management is recommended first. Now, medication, stimulants, Adderall, Ritalin are generally the first line fast acting treatment, working by increasing neurotransmitter levels. Non stimulants used when stimulants are not effective or cause side effects, such as clonidine. We have psychotherapy. We have CBT, helps patients change negative habits, improve time management, and boost self esteem. We have lifestyle support, ADHD coaching, regular exercise, proper sleep, and a healthy diet aid in symptom management. We have side effects considerations. Stimulant side effects may include decreased appetite, insomnia, and increased heart rate. Treatment approach: often a combination of medication and behavioral therapy works best. And long-term care, while often a lifelong condition, it affects can be managed with consistent customized strategies. Now here's how you treat it. How to treat ADD. I think I just spoke about, like, when I was writing this today, I was like, my mind was so all over the place. Diagnosing. Oh, here's how you diagnose it. Here's how it's diagnosed. The way I'm reading this, I'm like, I just spoke about how it's treated. Okay, what I meant to say was in the notes was, here's how you diagnose attention deficit disorder. Diagnosing attention deficit disorder was now formally termed ADHD, inattentive type, involves a comprehensive evaluation by a professional psychologist, psychiatrist, or pediatrician. Now, I was originally went to see a neurologist, but I think, formally diagnosed by a psychiatrist who I saw from the age of 12 up until for like 10 years. I was with her. I've spoken about her in the past. My mom still goes to see her. She's a great woman. It's a family practice. She's great. You know, but I just didn't work. Things just didn't work out with her. But that's besides the point. Rather than a single test diagnosis based on DSM-5 criteria, including 6 plus symptoms of children 5 and up, For adults, inattention, disorganization, and impulsivity lasting at least 6 months, starting before age 12 and causing significant impairment across multiple settings. Clinical interviews, detailed discussions with a healthcare professional regarding symptoms, personal history, and behavioral patterns, behavioral rating scales, questionnaires completed by the individual parents and teachers to evaluate symptoms, ruling out other conditions, medical exams, and history review to rule out anxiety, depression, learning disabilities, or other health issues that mimic ADD. Medical history, a review of medical and developmental history to understand the context of behaviors, and common symptoms of inattention, inability to stay focused or easily distracted, avoiding tasks requiring sustained mental effort, consistently losing important items, keys, wallet, paperwork, difficulty following instructions or finishing tasks, poor organizational skills. Now, I remember when I was a kid, I would be in class. Like, this is just based off of memory. This was before I was in like elementary school. I was diagnosed when I was in middle school, but I remember being in like elementary school. My grades were terrible. And I'm not saying just because you have ADD that your grades are going to be terrible, but my grades were terrible. I had trouble focusing. I didn't pay attention much. I just remember like class would be going on. I'd be staring off at the walls, looking around the room, not paying attention. So I do remember most before I was diagnosed of like how I would be in class. Like I wouldn't pay attention. I would call out a lot. Like call out meaning like I would just wasn't well behaved, and that has nothing to do with the ADD, but like I just wouldn't pay attention. I'd always be like paying attention elsewhere. So I do remember a lot of that. But like I said, I didn't have ADD. I had bipolar disorder, but that wasn't prevalent when I was like, what, 11 years old? I'm talking about 11, 10 years old. That wasn't, no. So, all right, let's move on to the next thing. It is important to consult a qualified healthcare provider for an accurate diagnosis, as symptoms can be caused by various factors. So, did I talk about assessment details? Oh, I don't think I talked about that. Assessment details often requires assessment of work performance, relationship issues, and history of symptoms. Children require input from parents, teachers, and observation of behavior in school and home. No physical tests. There are no specific blood tests or brain imaging tools used to diagnose ADD. And like I said, it is important to consult a qualified healthcare provider for an accurate diagnosis, as symptoms can be caused by various factors. 100%. Okay, so let's move on to the next thing. Now, here are some ADD coping strategies. Now I feel like today is going to be a lot shorter than most of my episodes have been. But like I said, there wasn't like I tried to structure this episode how I structured the episode about ADHD, but no, like learning, like I always knew ADD and ADHD were different, but when it came to my education, but I like I'm doing more research into this, and I'm like, oh, it's a subtype. I didn't know that. Like I always thought they were just different. Never really said it was maybe they did say, maybe I just wasn't paying attention, but now I'm learning it's a subtype. So, I'm trying to structure this how I structured the ADHD episode. So this is going to be a lot shorter today. It's not going to be as long as the other ones, but we're diving in as much as possible. I'm going to be as thorough as I can. Now, here are some coping strategies. Effective coping strategies for ADD and ADHD focus on structuring the environment, managing time through breaking down tasks, and regulating energy levels. Key techniques include using planners, 100%. I am all for planners. I'm a big proponent of them. Setting alarms, 100%. Utilizing checklists, practicing mindfulness, exercising daily, and breaking large tasks into smaller, manageable steps to reduce overwhelm, 100%. I agree with everything that the research just said. Organization and time management. Use visual tools. Rely on daily to-do lists, calendars, and sticky notes for reminders. And you can even use like your reminders on your phone. That was very, very detrimental to my success in school when I was going to college. That was very, very detrimental in helping me like remembering like, okay, I have a task to do today. I have homework. I have to study for this. Very detrimental. So I do say visual tools are very helpful. Structure your space, keep your workspace, desk, and home clutter free. Reduce distractions 100%. Time blocking. Um, Break large projects into smaller 15 to 20-minute tasks with breaks in between. Set alarms. Use phone alerts for transitions, appointments, and to prevent losing track of time. 100% time management is definitely key to helping you, have success in little areas in life or big areas, whatever it may be, whatever you're trying to manage your symptoms and in a way that's going to help you succeed at whatever you're doing, then so be it. I agree with everything this is saying. Productivity and focus. Body doubling. Work alongside someone else to increase accountability and focus. Minimize interruptions. Use noise canceling headphones. Turn off your phone. I like right now I'm doing this, and I do this when I put on DND, do not disturb, because I know like one day I'm just going to be doing this and my phone's not going to be on do not disturb, and one of my nieces is just going to casually FaceTime me. I'm going to get a text or something. So I like to do my tasks with like on do not disturb sometimes. So I just the distractions and interruptions. Prioritize tasks. Tackle the most important or difficult tasks first to avoid procrastination. Daily exercise, engaging in 30 to 40 minutes of physical activity helps release excess energy, boost mood, and improve focus. 100%. Mindfulness and meditation. Practice deep breathing and meditation to manage stress and calm impulsivity. Prioritize sleep. Establish a consistent, quiet, and predictable bedtime routine. Use fidget tools. Utilize stress balls or fidget devices to help maintain concentration during sedentary tasks. Now, my nieces, I don't know if has anything to do with like fidget tools. They just started getting into like these things. What are they called? They're called like hold on, I have to go into my phone to see like my niece was flipping out because she lost hers the other day. And I was telling my mom, I was like, oh my God, I was about to hold on, let me see. They're called, hold on, excuse me. I forget what these things are called. The kids, they come out with new things every day for these kids. They're on to the next thing. First, 2016, it was fidget spinners. Now, oh, they're called Neatos. So my nieces just got into Neatos, which are these little stress balls. They're like squishy little stress balls. My mom's been buying them for them. My sister's been buying it for them. They have a few of them. But I think it's good for them to have. So I'm not against it. But like I said, Neatos, maybe if you look into Neatos for kids, support and self-care, professional help, seek therapy such as cognitive behavioral therapy to identify triggers and learn tailored coping skills, learn to say no, avoid overcommitting to tasks to prevent burnout, and a nutritious diet, eat a balanced diet as this can affect focus and energy levels. Um, Now from my education, I learned that there is a difference between ADD and ADHD. But in doing the research, I learned that I think I've talked about this multiple times. Let's dive more into why they're labeled the same, and let's see why. Now, ADD, attention deficit disorder, was updated to ADHD because research showed that inattention, hyperactivity, hello? Hello? That was not a fart. That was my bed. My bed makes a lot of noise. Sorry, my microphone went out for a minute. So let's get back to what I was talking about. Attention deficit disorder was updated to ADHD, attention deficit hyperactivity disorder, because research showed that inattention, hyperactivity, and impulsivity are often combined, making ADHD a more accurate comprehensive term, officially changed in 1987. The update recognizes hyperactivity is not always present, leading to the inattentive subtype ADHD. Scientific update: the change from ADD to ADHD was driven by the recognition that attention difficulties and hyperactivity impulsivity often coexist. Outdated terminology: ADD is considered outdated term for what is now classified as inattentive type ADHD. 3 subtypes. The modern understanding classifies the disorder into 3 types under the umbrella of ADHD. Predominantly inattentive presentation, formerly ADD, hyperactive impulsive presentation, combined presentation, improved diagnosis. The updated terminology helps clinicians better identify individuals who might have been missed under the old limited definition as noted by Dr. Kaufman at the Cleveland Clinic Health Essentials. Now, here are some resources for ADD and ADHD. I kind of combined them both. I took some from the ADHD episode, and I also found some for ADD because they're kind of the same thing. And if it is considered a subtype of ADHD, I'm sure a lot of these ADHD resources can help with ADD as well. So top resources for ADD and ADHD include CHADD, Children and Adults with Attention Deficit Hyperactivity Disorder, ADD Attitude Magazine, which is spelled with ADD, and the Attention Deficit Disorder Association, ADDA, which provide evidence-based information, support groups, and coping strategies. Some key tools include the National Resource Center for ADHD, NRC, for expert webinars, the National Institute of Mental Health, NIMH, for research-backed literature. Now we have chadd.org, which offers a comprehensive resources, parent training, and local support groups for families and individuals, and that is spelled CHADD.org. Attitude Magazine, the website is additudmag.com, which provides articles, webinars, and expert advice on managing symptoms, treatment, and daily life. We have ADDA, which is add.org, focuses specifically on resources, support groups, and workshops for adults with ADHD. The National Resource Center on ADHD, helpforadhd.org, a program of CHADD, which is called CHADD, that acts as a national clearinghouse for evidence-based information. And then we have ADD Resource Center, addrc.org. It provides coaching, screening, and strategies for personal growth and relationships. And then we have the National Institute of Mental Health, NIMH, offers brochures and information on symptoms, diagnosis, and treatment. And then we have the Center for Disease Control and Prevention, CDC, features ADHD toolkits for different life stages. The Mayo Clinic provides clinical information on diagnosis and treatment for adult ADHD. And then we have Digital Tools and Strategies, which is understood.org, offers resources for learning and attention issues, body doubling, techniques recommended for focus, such as working alongside others for accountability, organizational tools like use of checklists, apps, and sticky notes to manage daily tasks, and some crisis support, 988 Suicide Crisis Lifeline, call or text 988. I'll give that resource again at the end, like I usually do. Here are some more reliable resources. I spoke about CHADD, I spoke about ADA, and NAMI, the National Alliance for Mental Illness, offers help and resources for mental health conditions, including ADHD. We have Totally ADD, which is an online resource and community. It has videos, forums, and resources for adults with ADHD. We have ADHD Together. We have How to ADD, a popular YouTube channel with practical ADHD advice. We have the Suicide Crisis text line. You can call or text or chat for immediate mental health support, and I'll give you more of that resource at the end. University Center institutions like ICHAN, School of Medicine at Mount Sinai offer expert resources. We have healthcare providers, specialists in ADHD are crucial for diagnosis and treatment. Now, here are more resources. The Center for Disease Control, I gave that, but let me give you the website. It's cdc.gov/ADHD. And then we have CHADD. I gave that resource. It's chadd.org. I'm looking for more resources. Attitude Magazine, I gave that resource. Societyforadhd.org. They advocate for ADHD awareness with equitable access to education, assessment, and treatment with a focus on culturally relevant support. We have How to ADHD, I gave that already. InsideADHD.org. ADHD subreddit communities for peer support and shared tips. Curated lists of ADHD books, podcasts, search awesome ADHD resources online. National Resource Center on ADHD. The number is 1-866-200-8098. They can answer general ADHD questions. What else do we have? We have 2.0 Taking Charge of Adult ADHD. That's a book. Podcast. Oh, that was a podcast, excuse me. So we have ADHD books, How to ADHD 2.0, Taking Charge of Adult ADHD, podcasts about focus and executive functioning, ADHD coaching or skills groups, organization and time management apps. So here are some celebrities with ADD and ADHD. I think I've gone over most of them, but since it's a subtype, there'll be a lot of repetitive celebrities. So we have Simone Biles, gymnast. She has ADHD. Michael Phelps, he has ADHD. Terry Bradshaw, Mark Ruffalo, Ben Whitaker. We have Adam Levine, Justin Timberlake, will.i.am, Solange Knowles, Nelly Furtado, Zayn Malik, Sam Fender. We have Paris Hilton, Ryan Gosling, Woody Harrelson, Howie Mandel, Emma Watson, Jim Carrey, Zooey Deschanel, Channing Tatum, Ty Pennington, and Johnny Depp. Oh my goodness, excuse me. Okay, some of these people in the business and science category I refuse to mention because they were in the Epstein files. So okay, we have Lisa Lang, Jenny Lawson, Glenn Beck. Who else? Okay. Let me give you some affirmations. I'm sorry, that was a little. Today's research didn't really give me much specific details about these people, but let's go to the affirmations, my favorite part. Now, for self-acceptance and focus, I am enough. I accept my differences as opportunities to grow. My mind works in creative and unique ways. I am not the sum of my ADHD challenges. I forgive myself for past mistakes and move forward. I am perfect just the way I am. Productivity and task management. One task at a time. Done is better than perfect. Just focus on the next step. I can handle what the day brings. A clear plan creates a clear mind. I can choose to respond and not react. So, like I said, it was a very short episode today compared to the ones that have been an hour recently. So thank you guys for listening. I hope you have a great weekend and a happy Valentine's Day. Remember, you are loved whether you have a Valentine or not. Now, next episode will be about schizophrenia. The one after that will be about anxiety of public speaking. And the one after that will be about alcoholism. So if you or anyone you know is struggling, text HOME to 741-741, the crisis text line, for a free confidential conversation with a trained counselor at any time of day. Text or call 988 or use the chat function at 988lifeline.org. 988 continues to offer support to anyone who needs it, but no longer offers specialized LGBTQ plus support. If you're looking for specialized LGBTQ plus support, you can contact the Trevor Project directly. You can call 1-866-488-7386 or text START to 678-678 or connect online at trvr.org/get-help. And you can find more crisis resources at the jedfoundation.org/crisis. The new lifeline for the LGBTQ plus community given by Canada is 1-877-330-6366. And you also have the NAMI helpline at 800-950-6264. You can text NAMI to 62640. There's a help tool for To Write Love on Her Arms, which is twloha.com/find-help. Some peer support groups, twloha.com/peer support. And you also have mentalhealthtoolkit.co. And the crisis text line for the To Write Love on Her Arms is text TW LOHA to 741-741. So thank you guys for listening. I'll see you next time. Remember, this too shall pass. I love you guys. Stay well. Bye bye.